We will see the other class of drugs called as anticoagulants. So the name itself indicates they are acting against the coagulation. So anticoagulants are the drugs which are reducing the coagulation capacity of the blood. So the blood have, because of the platelets or thrombocytes which are present in the blood, that are causing clot formation. So it is reducing the platelets to clot. So it is reducing clotting capacity of the blood. So these drugs are tend to prevent the new clots which are tend to prevent the new clots. So these drugs, they won't allow any new clot formation. So there will be existing clots. These drugs, they never dissolve the existing clots, but they prevent the new clot formation, and even they prevent the expansion or extension of the existing clot. And these are also given to certain people who are risk with forming of blood clots. So in the sense, we can predict that by the biological functions of their body, we can say that this person is more prone to clot. If there is any high thrombocyte count, then we can say that this person is having more blood clot formation, chances of more blood clot formation. So in such people, we can give these drugs prior in order to prevent the blood clot formation. Let us see the classification of anticoagulants. These anticoagulants are divided into two types, in vitro as well as in vivo. So in vivo are the drugs we are giving into the body from external source, and in vitro drugs are the drugs which are naturally synthesized in the body. So here in vivo drugs are further classified into parenteral anticoagulants and oral anticoagulants. So this parenteral anticoagulants are further classified as heparin and its derivatives. So in this heparin also, there are low molecular weight heparins and high molecular weight heparins. So high molecular weight heparins include unfractionated heparin, and low molecular weight heparins include enoxaparin, dalteparin, tinazepam, and reviprin, and danaparoid. So these are the low molecular weight heparinoid analogues. Now let us see heparinoids. So heparinoids, they are similar in structure with the heparin, and they include heparin sulfate, hirudin, lepirudin, bivalirudin, and argatroban. Let us see the classification of oral anticoagulants. So these oral anticoagulants are further classified into coumarin derivatives and indaldione derivatives. So coumarin derivatives include bis-hydroxycoumarin, which is also called as dicumarol, and warfarin sodium, acenocumarol, which is also called as nicomalone, and ethynyl biscoumacetate. And the indaldione derivatives include phenandione. Now let us see the in vitro drugs. So what are the in vitro drugs? The drugs like heparin, sodium citrate, sodium oxalate, and sodium editate. So these are the compounds which are synthesized in the body because of the various chemical reactions. For a blood to clot, in order for the clot formation, there are various factors. There are 13 number of factors which are aiding in the formation of clot. So if we see the clot mechanism, or if we see the clot cascade pathway, in that all these 13 factors, they are aiding in the clot formation. So here the factors which are involved in the clot formation are factor 1, which is also called as fibrinogen, factor 2, prothrombin, factor 3, which is called as tissue factor or thromboplastin, factor 4 is calcium, factor 5 is proaxillerin or labile factor, and factor 6, which is not an independent factor. In the sense, this factor is not given any name, but recent researchers said that this factor 6 is called as axillerin. So because it promotes the formation, or it aid in the acceleration, or it aid in the fast clot formation. So that is the reason this name is given to this factor. The other factor, 7th factor, is proconvertant, which is also called as stable factor. Factor 8 is antihemophilic factor or globulin factor. 9th factor is antihemophilic factor B, which is also called as Christmas factor. Factor 10 is Stewart-Prober factor. Factor 11 is plasma prothrombin antecedent factor. Factor 12 is Hageman factor, and factor 13 is fibrin stabilizing factor. So all these factors, they aid in the clot formation. Now let us see the pharmacology of individual drugs. So So this heparin, in order to show its pharmacological property or in order to show its anticoagulant property, it should have few characteristic features. So this heparin, it is first discovered by a person called as MacLean, and the word heparin is given by the persons called as Howell and Holt. So these are the persons who gave this compound